Here we have trigger finger. We will be going over this diagnosis today. If you're watching this video, I hope that the educational printout was of value to you. This video will be an overview of that printout, but it will be a little bit more elaborated on. So here we will be talking about an orthosis or splint that your therapist might have made you during the first visit. And to be specific, an MP blocking orthosis would have been made, one that looks like the picture to the right. This will stop you from any locking or catching symptoms that you might have had on your finger. Again, your therapist would have determined during the first visit if you needed one or not. If you did need one, your therapist would have recommended when to wear the orthosis, whether that is at all times, nighttime only, or any other scenario that they said. They would have checked this off on the educational printout that you received during your first visit. And these splints can be washed using cold water or wiped with an alcohol pad. If you were to wash these splints with hot water, the splint material would mold into a different shape and it would not fit correctly. Here we have prefabricated braces. These braces might not be an exact fit like the last orthosis that might have been molded to your hand, but they could be beneficial for some people. So these items can be purchased to aid in your health management of trigger finger to stop that locking and catching symptom. These can be purchased online on an Amazon or any other bigger website like a Walmart, or they could be found in your local Walmart, Rite Aid, CVS, whoever it might be. These braces are considered to be an MP blocking brace, just like the orthosis that might have been made in the previous slide. Your wear time is going to be marked down in the previous slide, whether that is at all times, nighttime only, or any other scenario. You want to make sure you wear this brace snug enough for the affected finger to not bend down all the way. Here we will be talking about what exactly is trigger finger. Trigger finger occurs when the A1 pulley and the flexor tendon becomes inflamed and thickened. So as you can see in the picture to the right, the red object under the bone is the flexor tendon. You can see it kind of goes through the A1 pulley, which is white thickened material in front of the joint. So the flexor tendon is supposed to glide under that A1 pulley, which holds the tendon really close to the bone. When the thickened tendon gets stuck in the pulley, that's when the finger will start getting that clicking or locking symptom, and it'll get stuck in a bent position. The most common fingers that have trigger finger are the middle finger and the ring finger. Trigger finger can occur in all the fingers, including trigger thumb, which would be called trigger thumb. You may have one or more of the following symptoms: locking or clicking of the finger, pain when bending the finger, as pictured to the right, where that person is holding their hand exactly at that A1 pulley, where that redness is in the picture, soreness at the base of the finger or the thumb on the palm side of the hand, exactly where they're holding it again, and swelling. There are a few aspects that trigger finger can be caused or attributed by, which would be forceful hand activities, age. As someone ages, they're more likely to have trigger finger. Conditions such as diabetes or rheumatoid arthritis, and also genetics. A common question always put out there is, how long will I have trigger finger for? What I will say, it depends on everybody. Without surgery, it's different for everybody because it depends on the following factors: how severe the trigger finger is, and how long trigger finger has been affecting somebody. With surgery, on the other hand, it's a little bit different. There's more of a time frame to it. Occupational therapy or hand therapy can help and is needed to prevent flexion contracture, decreased scar tenderness on the finger that had trigger finger, and improvement of range of motion. Participation in normal activity is different for everyone, but it tends to be 1 to 4 weeks after surgery. Modality use, heat in particular, will be a benefit to trigger finger or trigger thumb. Using a hot pack could help with trigger finger symptoms, or a do-it-yourself hot pack can be created simply by putting uncooked rice in a bag or a sock or even in a bowl, heating it up for 30 seconds until it is warm, and then you want to apply heat with a towel, 2 layers of towels in between the skin and the heat source. Heat can be applied for 10 to 15 minutes at a time every time you do it. Specific benefits of heat include the following: pain relief, an increase in blood flow, which in turn promotes healing. So the more blood flow in an area, the more healing the area will get. It'll improve extensibility or loosen up the muscles in the area, or loosen up that specific tendon that is affected, and it can decrease stiffness. So as you probably already know, you won't be able to do certain activities like you did before with trigger finger. So you will have to modify how you do some other activities. So, for example, here are some tips to help with modification of certain activities. You want to avoid hard gripping activities where you have a hard grip on something. You want to hold items using a hook grip. So, for example, a hook grip is pictured to the right. It can be seen at the bottom picture and the second picture, while the top picture shows a hard grip. So you want to avoid that hard grip, and you want to use a hook grip where you're really making a hook fist and you're just bending the tops of your fingers, not the whole hand into a full fist. You want to avoid making a tight fist. You want to take frequent breaks when necessary. I know it's tough to take breaks, but whether it's 5-10 minute breaks, to give yourself a rest and the effective finger rest. And you want to hold items without gripping if possible, like having your palm out nice and flat and holding an item like that. Essentially, you want to not make a hard grip or tight grip. Now I will start talking about the home exercise program that you have. These home exercises are in your educational printout. The reps, sets, the amount of times you would want to do this are in the printout as well. Here we have this first one called passive DIP and PIP flexion. First, you want to have your hand flat on the table, as pictured in the top right picture. Then you want to assist and use your other hand to bend or flex the affected finger, as pictured on the bottom right. You want to hold that position for 5 seconds. After 5 seconds, you want to straighten it back out. Again, your reps and sets will be on your educational printout. Here we have an active hook fist. You want to start with your hand flat, up in the air, elbow on the table, or just up in the air in general. However you want to do this, you want to start with your hand flat as pictured in the top right corner. Then you will bend the DIP and PIP joints, the joints that we bent in the past slide, and you want to bend without moving your knuckle or your MP joint. This one requires no assisting with the other hand, and this is a type of grasp that you are allowed to do or able to do without making your symptoms of trigger finger worse. So you don't want a full tight grip or grasp, but a hook grip. And this is how you will be able to hold certain items without any symptoms. So here's a specific exercise for trigger finger in your thumb. This one is called thumb IP blocking. What you are going to do is hold the base of the thumb below the thumb fingertip with the finger on the unaffected hand. So you need your other hand to do this. You want to start as pictured in the top right picture. And then you want to bend just the tip of the thumb down as pictured in the bottom right picture, and then straighten it back out. Again, reps and sets will be on your printout that your therapist had given you during the first visit.